Pharmacy exam MCQs. First question. Which local anesthetic should be used to treat symptoms of pain, itching, burning, and discomfort in patients with an established lidocaine allergy? Options are tetracaine, dibucaine, pramoxine, benzocaine. So the answer is option C, that is pramoxine. Because of its chemically distinct structure, pramoxine exhibits less cross sensitivity compared to the other anesthetics and should be used in patients with a lidocaine allergy. Which of the following is an appropriate non-pharmacological recommendation for patients with gastroesophageal reflux? Options are eat larger but fewer meals, avoid meals high in protein, eat evening meals at least 3 hours before bed, prop the head up with two pillows at night. So the answer is option C, that is eat evening meals at least 3 hours before bed. Patients should be instructed to eat evening meals at least 3 hours before going to bed. This allows sufficient time for gastric emptying so that the volume of refluxed material will be smaller and less irritating to the esophagus. All of the following are acceptable uses of magnesium hydroxide except options are heartburn, dyspepsia, hemorrhoids, constipation. So the answer is option C, that is hemorrhoids. Magnesium hydroxide, for example, milk of magnesia, may be used for the symptomatic relief of heartburn, dyspepsia, and constipation. Magnesium hydroxide is most noted for its potential to cause diarrhea. Indirectly, it may provide relief from hemorrhoids if they are due to constipation, but will not have a direct effect on elevation of hemorrhoids. The most common cause of vaginal yeast infections is options are Candida albicans, Candida glabrata, Trichomonas, anaerobic bacteria. Answer is option A. That is Candida albicans remains the most common cause of vaginal yeast infections. Infections caused by Candida glabrata are increasing. Trichomonas and anaerobic bacteria cause other types of vaginal infections. When assisting a female with the purchase of a vaginal pH monitor, which of the following should be discussed? Options are the pH monitor is not recommended in postmenopausal women. An elevated pH indicates the presence of a yeast infection. The pH of a clean catch morning urine sample should be used. The pH monitor can detect the presence of sexually transmitted infections. So here the answer is option A. The vaginal pH should not change with a yeast infection but may with other vaginal infections. The sample is taken by pressing a wand against the vaginal wall, not collecting a urine sample. The monitor is not recommended for women who lack estrogen, such as in the case of postmenopausal women, or for the detection of sexually transmitted diseases. So with this question, we will wind up today's question discussion series. Thank you everyone for your support. Please don't forget to like, share and subscribe. Have a pleasant day.